Other news now, a recent study done by Stanford, Yale, and UC Berkeley. Big dogs confirm that mask wearing is an effective way to decrease the transmission of COVID-19. Researchers found that surgical masks prevented 35% of symptomatic infections among people 60 years and older.
KRON 4's Taylor Bisacky is joining us here now live in the studio with more on the study. Taylor, what did it show?
Well, I know many of us often wonder which masks are most effective, especially now with the Delta variant. And, you know, some people may perceive these surgical masks as flimsy or non-reusable, but researchers found that these surgical masks are more effective than cloth ones, even after you wash and reuse them several times. Researchers at Stanford, Yale, and UC Berkeley found just how effective masks can be in reducing the spread of COVID-19 in the largest mask study to date. Their recent study was done in Bangladesh across 600 villages and more than 350,000 adults. While they found masks in general provided a 9% reduction in COVID-19 cases, surgical masks were more effective and reduced cases by 11%. Researchers say effectiveness continued to climb among older adults.
In people who were 60 and above, we found that we were able to prevent 35% of COVID-19 cases.
Infectious disease expert at Stanford University, Ashley Stachinsky, who was one of the lead authors of this research, says the study was done when cases were lower, before the Delta variant became the dominant strain. So they predict case reduction would be larger today.
I think that this is probably an underestimate of the real impact of masks for a number of reasons, including the fact that we only measured COVID-19 among people who reported symptoms consistent with COVID-19 case definitions during the study period, and then measured their blood for antibodies against the virus. So we may have missed cases that were asymptomatic.
Stachinsky says these lessons can be applied to the United States, especially when comparing surgical masks and cloth masks, even after several washes.
One of the barriers we had, though, at the time to rolling out surgical masks is that people would perceive them to be flimsy or less durable, and so they wanted something that they could reuse. So we responded by doing the tests on what happens if you wash a surgical mask. And what we found was that filtration efficiency drops from about 95% to about 70 to 75% after that first wash, but then it stays there after subsequent washes, still giving you much better protection than your cloth mask.
Now, in comparison, Stachinsky says that cloth masks only offer about 10 to 20% of filtration efficiency. She says mask use also tripled among people when providing free masks, informing people about the importance of covering their mouth and nose, reminding people when they were unmasked in public, and by showing that community leaders or prominent figures were also wearing their masks. Back to you.
Interesting.